China has reported a sharp rise in the number of people infected with the Wuhan virus. 217 cases are now confirmed. For the first time, cases have been reported in Chinese cities outside of Wuhan. 5 cases are confirmed in Beijing and 14 in Shenzhen. The virus is also spreading beyond China's borders. South Korea has confirmed its first case, a Chinese woman who had just been to Wuhan. And in Singapore, passengers on all inbound flights from China will be subjected to temperature screenings at Changi Airport from Wednesday. Individuals with pneumonia and a travel history to Wuhan will also be isolated in hospital as a further precautionary measure. The ministry says the moves are in anticipation of the increase in travel volume leading up to the Chinese New Year holidays. The Health Ministry and the National Centre for Infectious Diseases has also developed a joint clinical guidance on the new virus. It's been distributed to emergency departments and infectious diseases physicians and public sector hospital labs and is on how to manage suspected cases of the virus. A 44-year-old Singapore resident with pneumonia and who had travelled history to Wuhan is the latest suspected case. The ministry says she's been admitted for further assessment and treatment and isolated as a precautionary measure. Her condition is stable. The ministry says she did not visit the Huanan seafood wholesale market associated with the cluster of pneumonia in Wuhan. The latest case brings the number of suspected cases of the Wuhan virus in Singapore to 7. The previous 6 have all tested negative.
And for more on the virus, expert Dr. Keith Chappell, Senior Research Fellow at the University of Queensland, who joins us live from Brisbane right now. So, Dr. Chappell, the number of cases, it seems to have jumped in just a matter of days. Why do you think that's the case, though?
So the reason for this is we now have a sequence of the virus, so we know what to test for. So I expect testing is underway of a large number of patients, and they're being reported, and we now know that that's Wuhan virus.
Well, China claims to have the situation under control. Do you think local authorities have taken adequate measures to contain the spread?
So it's extremely difficult to say. There are just so many unknowns about this virus. Definitely for the severe infections, it's easy to contain these, and once they're admitted to hospital and they're receiving treatment, the biggest unknown is the mild and moderate infections, and there's unfortunately not much we can do to, people that are practically healthy to identify these people.
All right, so saying that, then how worried should we be, or the impact of this could be on the Chinese New Year travel rush? Could it have?
So I don't think this is going to have much of an effect at all on the travel around Chinese New Year. It's a very small number of infected compared to the Chinese population, obviously. And I think we just need to wait, and hopefully it will pass and we'll get through this.
Well, there are concerns that Chinese officials are actually underreporting the numbers. Experts in the UK are estimating that 1,700 are already infected. Do you believe Chinese authorities are heeding calls to be transparent following the lessons of the SARS outbreak?
I think China has been completely different this time around compared to the SARS outbreak. They've been very open in communicating results. Those numbers coming in with the 1,700 are purely estimates. The numbers being reported by China are confirmed cases, so they can't be compared. I think what this estimate suggests is that there are probably people out there with mild to moderate infections and what we don't know is whether or not they are infectious, whether they can transmit the disease. So that, to me, is the most worrying factor, whether there are people out in the community feeling fine, and if they can transmit the disease, that's a recipe for disaster, but we just simply don't know currently.
And that's exactly what the next question I'm going to ask you. Why haven't health authorities been able to work out how the virus is transmitted?
So I think it's safe to assume that there is a level of human-to-human transmission ongoing, and this is most likely or almost definitely through respiratory transmission. So of crucial importance is if you're feeling sick, have symptoms of influenza, that you need to stay at home and you need to be washing your hands when you go out in public, all those normal sort of precautions that we take during the influenza season.